Alright guys, welcome back to my channel. Today I'll just show you how operating theater in the hospitals looks like. This is the main M3 where patients come in from the wards. And then you have to change them here. This is where the changing area, you change them. Okay, make sure everything is done, checklist. This way you change them, put cannulas. Okay, then you bring them into the recovery area. This is the recovery area. We have only one bed for recovery. Very small, so we have one bed for recovery. So we recover patients. We have only 2 rooms. That's room 1 and that's room 2. This is our sterile room. We keep all the sterile items, our trays. We have all the trays there. That's deep laparotomy trays, cesarean section tray. So different types of trays for different procedures. So, and then gowns. We have drapes and all other things that we will need. We preserve them. This is a sterile room, meaning that we sterilize them. So we control any outside exposures. Always we keep it closed. Yeah, so then recovery. And then you have room 1. We do many cases here. That's the bed. That's the theater light. Bro, can you switch on the theater light? Yes, that's the light, theater light. If you haven't, been to a theater, so that's the operating bed. That's a manual one. These ones are very old ones. They have been using this for many years and they're very old. So that's the theater light. So when you come in, the patient sleeps on the bed. Then they will, the anesthetist will, there's the anesthetic machine. We have the monitors. They will monitor you while you under anesthesia. So the anesthetist or whoever that will anesthetize you will check your vitals, blood pressure, your heart rate, your saturation. It will keep monitor you intraoperatively. So while the surgery is going on, the anesthetist will keep monitor this. Make sure you are safe and well until the surgery is done, and they will wake you up. So that's the minor room. It's not a big room, so it's a small room. So switch off the light. There's a suction machine there. There's oxygen cylinders, nitrous oxide, all the other consumables for the anesthetic team and the nursing team. All right, let's go to room 2. But before we go to room 2, this section is for the anesthetist. They stock up their consumables here. So different types of ETTs, endotracheal tubes. All right, then you see the drugs, regular drugs, all those anesthetic drugs, muscle relaxants, hypnotics, and other. I think they don't give the opioids for pain management. Yep. Then you have the good old airway, all the other necessary airway equipments. And then there are other things here, normal saline, all the crystalloids, and not many colloids there. So we have needle syringe, all other consumables. Then you come scrub here. For both rooms, you scrub here, and then you come into the main operating theater. This is the main theater. So this is the bed, operating bed. And then we have the trolleys and other consumable sutures. The Mayo stand, IV stand, oxygen. And then we have the anesthetic trolley. We have the anesthetic machine. This anesthetic machine is a old one. Boyle's anesthetic machine. This is an old one that we are still using it. Since we don't have the latest machines with ventilator. So we make use of this old one. Any machine, you have the suction machine, you have the X-ray viewer. Yeah, I think that's all. That's a simple theater looks like, but setting of the bigger theaters will be different from this one. Okay, that's all for today. God bless. Bye.